Welcome everyone to a brand new month. Today is the Friday, 1st March. In this video, I'm going to talk about my perspective, what I think on the future generation of thalassemia patients, especially those more severe form of thalassemia, the thalassemia major like me. Because 2 weeks ago, I attended the Singapore General Hospital. They have the annual kind of Chinese Lunar New Year dinner. So after the dinner, I went back with a staff nurse of the SGH where I have my transfusion there every 3 weeks. So while we was going back, because we are on the same journey back to our locations, I alighted 2 stops after her. And while in the train, we was talking about what is going on in the workplace where she is working. And I randomly come out with a question because I was wondering, because I don't know the answer, so I come out and see whether she know. I was asking whether there is any there is more or less or no kind of newborn and the more severe form of thalassemia. I thought there is no more because of the prevention, screening, ethics available, the more restrict kind of like more complete screening available now for thalassemia. But to my surprise, there still has a few of the newborn case of the more severe form of thalassemia, but there's a tremendous decrease as compared to my generation or those who are slightly younger than me. There's the end of the static, whereby now they have like tremendously reduced to a point where it's kind of rare, at least in Singapore. I'm not sure whether in your country there is a newborn thalassemia major or at least intermediate that require blood transfusions. But I think it's a good thing that the future generation has slowly improved over time, and now I hardly seen any newborn thalassemia major in because maybe I moved to the adult hospital. I have to take a look back to the KK Urban and Children Hospital. By the way, it's quite a long time since I go back to visit. Might be maybe in the before work, I might go back and take a look and visit the staff nurse, see whether they still remember me and any changes over there. But they, according to the nurse, they say there's less patient now diagnosed with the condition, more severe form of thalassemia. That's a good thing. And the current stage in thalassemia major within our age group, maybe the teens or early 20s and maybe 30s, they are now on a more complete kind of treatment and prevention for further future complication. So I think until the cure out, the future perspective is good for now. Besides, you have to take care of yourself, main point, because it's a good thing now we have the medical advancements, yeah, the screening, prevention, the aesthetic, blood tests, MRI screening that will clearly help a lot to have a longer lifespan and prevent more future complications that will lead us to. Because according to recent news and article, hyperchoruria drug now could be used to treat or cure younger thalassemia major patients. Not all, but a good percentage of them, and that involve the aspect in reducing the rate of new diagnosed thalassemia major, or the in the process of getting into the severe, maybe they are thalassemia minor and now they are cured, so they won't turn up into thalassemia major needing the regular blood transfusions, on top of other factors such as the bone marrow transplant now might not need siblings matched bone marrow, might be a donor of the blood type could be used as a matched bone marrow. I'm not sure exactly how it works, but it could be that way. A donor with the same blood group or the same blood type can be used now. And the future of the cure, gene therapy, could not be brighter, as the patient already now undergoing, and still maybe after the gene therapy still have to plan on whether there's any further complication after the gene therapy. And for now it's good. Meantime, you take care and let us wait for the cure to be out. So thanks for watching. I'll see you guys in the next one. Bye for now.